and welcome back. Part 3 of my brilliant series with Dr. Uchenna Okoye, who's my dentist. Today, we thought we would bust some teeth bleaching myths. Everybody wants whiter, brighter teeth. But what's the healthiest way to do it? What to avoid? What's really dangerous? What you shouldn't buy? We're going to get some real warnings from an expert here. And the reason I selfishly wanted to get Uchenna back is because she gave me a system and it hasn't really worked out for me, so we're going to find a way around it as well. Teeth bleaching, good or bad?
Fabulous, as long as you come to someone like me. You have to go and see a dental professional.
Okay.
In fact, it's actually illegal for anybody that's not registered with the General Dental Council to do whitening. And why? I don't understand why people would trust their mouths and their healths with a non-professional just to save money.
Is it different in different countries?
Yes, actually. England, I love being a Brit. In England, we are really, really careful.
Okay.
You know, it's all about health. We're very conservative. So in this instance, it's great.
Okay. In America, because I've got some products here that we're going to talk about, in America you can just buy teeth whitening strips over the counter in CVS or Ulta or anywhere like that, can't you?
Like that.
So this is the CVS own brand Brilliant White Whitening Strips, and I don't know if you know them, but they're literally like little plasters. I have never used these. They're literally like little plasters for your teeth. Basically unpeel them and put them on, and you can carry on during your day-to-day activities. And what they do is they contain a low level of hydrogen peroxide.
Yeah.
And they're actually really easy to use, and they're totally legal to buy in America.
They're horrible.
I think they're really easy to use.
Yeah, you're sticking things and you're dribbling, and it's like, anyway, just not that I'm biased at all.
And I got these for a filming purpose because I wanted to talk about this.
Yeah.
I suspect that they're all made by the same company. These are the CVS own brand ones, but the one that most people want is the Crest ones.
Yeah.
Now, you said to me earlier on, Crest is the same company as Oral-B.
Yes, so you can actually get your Crest strips in England now.
How do you go about it?
Well, you have to go to the dentist.
Okay.
So you can't buy it over the counter, which for me, I think is awesome because it then means that the dentist can assess, make sure that you're suitable for it. Once you've got the green light, then you can just buy them, as much as you like, and you can post them off to people and all the rest of it.
Okay.
But in other countries,
you do sell
don't need to.
the Crest equivalent to this in the UK, but you sell it under the Oral-B brand.
Yes.
Right, because it's the same company, different country. Okay. And what strength, when you buy these strips, the little plasters that you put on your teeth, how often should you use them? What strength are they?
See, the thing about these things that you can buy, it doesn't tell you what the percentage is. Even I, as a dentist, would not be able to tell you. It just says it's hydrogen peroxide. In England, the maximum that we can have is 6%. So a lot of them, you can get 10%, 16%. So when you hear people talking about, their gums are burnt and all the rest of it, it's because of using peroxide that is too strong.
Okay.
So the key thing, when you say, I might say I don't like this, but these are great. What I say to people is to use this as a top-up. So get your teeth professionally whitened first, and then maintain with this. Although to me, I'm like, why bother? If you have it done professionally, you have your trays anyway. But
it'll be a cost thing, won't it? People want to do it cheaply, that's why.
No, but if you're going to do it professionally, save up, don't have any Starbucks for 3 months, you can go and get it done.
How much do teeth whitening start at?
It starts
It's going to be more in London, obviously, but outside of London.
You can, for $3.50.
Okay.
Yeah,
and then, so what happens is, if you have it done professionally, you have a mould taken of your teeth and you end up with little plastic, super thin trays that you can put on your mouth, and then you put the peroxide in. And what strength did you give me?
So I gave you a combination. So it started off as 10%,
and then
because it's very gentle, and then you go to 16%. Because all this stuff should be all gain and no pain. So there's no need to be in a hurry.
And then what you do is you sleep in these overnight if you have them done professionally, and they're custom made to my teeth. So
if you pop it on, people think it's going to be a big bulky thing, but it's actually, darling, I think that's your bottom.
Is that the bottom?
There we go.
Oh, there you go. Because the minute they're on properly, you feel them. They literally stick on.
Just go in, and then you stay, and then you sleep with them overnight. because really you're sleeping, you're not doing anything, so it might as well be working. So there we go.
But I can't sleep in it.
I know.
I just can't get used to it. I last about an hour and then I take it out. They're such a good fit. And I throw them across the room. Super, super, super angry. So, but you were saying to me I can use them during the day.
Yes, you can use it. So, if you had let me know, I'd have told you to forget about the 10%, go straight to the 16%.
Okay.
And then just wear it for a couple of hours during the day.
Okay.
So whilst you're on your computer and stuff, and it's still effective. The reason why...
What's the minimum amount of time you need to keep them in for, really?
I'd say even
because each one of these is just an hour.
Yeah,
I'd you need to use them consecutively for 14 days.
But the percentage of this, well, the ones I'm assuming tends to be much higher.
Okay.
So which is why. But I'd say if you can wait, say 2 hours is fine.
Okay.
You know, or even if you do an hour, it will have an effect. It just may mean that you need to do it for a little bit longer.
Okay.
That's all. So the gel lasts for about 8 hours. It's still effective that long. But it's kind of, you pop it in as you're doing your work. The thing that you will find doing it during the day though is you want to have a cup of tea, drink some water. You'll find that you're drooling a little bit more. But it's fine when you're here by yourself.
Yeah, exactly. For me, I always think there's at least a 4-hour gap between breakfast and lunch or lunch and supper. So I was just hoping that I could use it. As long as I've got your go-ahead to do it,
yes,
I will do it. Now, you said originally that you could only sell strips at 6%. However, a gel, you can sell at 10 and 16%.
Yeah, but it depends though. The strips like this one is hydrogen peroxide. So the hydrogen peroxide breaks down to carbamide peroxide.
Okay.
And it's interesting. I don't know if you know that whitening was actually developed, it was an accident, like all great medical inventions, treating people that had had gum surgery. And so the peroxide works, it releases oxygen and it almost acts as a disinfectant. So the bugs that cause gum disease don't like oxygen. So they're using this, healing people's gum, like, oh my God, their teeth are getting whiter. Yeah, completely. So I actually use whitening, but it would be the gentle, the 10%. Therapeutically, if somebody's got gum disease or sometimes with like older patients that have got like arthritis and stuff and they get lots of cavities and we just kind of every 3 months they just whiten for a couple of nights and it just keeps their mouths hostile to the bugs.
So done properly, whitening can actually be beneficial to the health of your teeth. It's just if you're going onto Amazon and you're buying those home light gadgets and you're buying abrasive stuff, or even if you're buying them from high street chemists, you don't know what you're buying. The fact that Uchenna said to me she couldn't even see the strength on that, and Uchenna is a professional, that is kind of worrying. What should you definitely avoid?
Buying what you just said, anything over the internet. And even the key thing is ask your dentist what's best for you.
Okay.
Get them to check you, because if, for example, when whitening first came out, there were these stories of people going to A&E and it got a
burning
bad
their
name.
gums.
Burning their gums, but excruciating. I mean, like pain that you want to like jump off a bridge.
Dental
like,
pain's
really,
the worst pain anyway.
It's awful. Yeah. And why did they get that? Because they had like recession, they had exposed dentine, and it was literally like pouring acid in the wound. I'm kind of like, and teeth pain is so deep, it's hard to actually reach it. So people were suffering. So your dentist would be able to tell you that, seal it, get it ready. And it's just, I love doing it. It's so beneficial. It doesn't do any damage. In fact, if you're
Do you do it in clinic?
Yes, you can do both.
So you'd have some sort of super fast in-clinic treatment. What do you call that?
So when it's in the surgery, we call it in-surgery or laser whitening. It's kind of it's whichever name.
So it's light activated,
yes,
is it? Yeah.
And how
long does that take?
About an hour and a half.
Okay.
But a little tip is that in spite of all the marketing hype, the two of them have the same end result. Okay. So you're paying for speed. So it's funny that I tend to do the in-surgery for the guys because I can do it to me.
Yeah.
Whereas we as women, we're used to doing all sorts of things to ourselves. So we can, wait the 2-3 weeks.
How many shades will you go up in clinic and then at home?
In clinic, probably immediately I'd say about 4 4 or 5 shades.
Okay.
If you get that, great. But I combine it, so I always give you trays to wear at home.
To wear at home afterwards.
So the best combination is literally, if you're doing it at home, 2-3 weeks. If you're doing it in surgery, after an hour, I'd probably get you to do 5-6 days at home, and then you get the same end result.
Okay.
So it's just quicker. But then it costs more.
And if you combine the two, you're going up 5 shades or more?
Oh, no. If you combine the two, 10, 12 shades, you can get up to.
Now, one of the things that people say to me is, what I don't want is, I don't want that Simon Cowell effect. Yeah. Sorry, Simon Cowell effect. You do know that that's not teeth bleaching, don't you? No. That is...
porcelain veneers.
Porcelain veneers.
Yeah.
So if you see that full-on fake whiter than white glow, that's not real teeth, that's porcelain veneers. Yeah. So don't panic, you won't get that. You'll just get a... Will you go lighter than the teeth you were born with, or can you only go back to...
What now I'm sounding like a politician. It depends.
Oh no, that's fine. No, because I just had a thought. Actually, can you go lighter than when you were a child, when your teeth are their most healthy?
No, really. No. That is the whitest your teeth will be, and really to know the whitest your teeth would have been is looking at the colour of the whites of your eyes, because that one stays the same from birth. So if you look at the two, then you can see, age. So if I lighten your teeth and get them matching close to this, the years come off. That's why teeth whitening is so anti-aging.
It's so anti-aging.
Yeah, what do people do? They'll do their face, they'll do Botox, and not their teeth.
My sister says exactly the same thing. My sister's worked in dentistry as practice manager for years. She'd be perfect for you, but sadly she won't work in the centre of town anymore. She's the most efficient person in the world. She spends the whole time looking at people going, but why haven't they done their teeth? They've spent a fortune on a facelift and haven't done their teeth. Teeth are so important. They really are. They really are.
It's why actually I love doing, shows like 10 Years Younger, because people
By the way,
see...
10 Years Younger is coming back in the autumn. I'm not sure if I'm even breaking an embargo.
Oh, well.
Oh, my goodness. Uchenna's befores and afters are mind-blowingly good.
I'm very excited. It's so thrilling to see the confidence. People are like this, and then they're like that, and really it's phenomenal. I love it. You're going to love the show. It's so good.
But I also love the subtlety of your work as well, because one of the reasons I trust you implicitly, and I don't have cosmetic work done on my teeth, I've just had some health work, but Uchenna does want to do some little bonding at the bottom, because I grind my teeth really badly and then bleach them and make them better. The reason I trust Uchenna implicitly is, one, because she's got a natural beautiful smile, but two, you like something to look natural and not done.
Yeah,
and
completely.
That's so important. That your aesthetic's the same as my aesthetic. Yeah,
I think, like, for me, job well done is you look like you but better, and people can't, and they're like, oh, have you changed your hair, or is it your clothes, or whatever. I'm gonna steal some of Uchenna's pictures if I can, and I'm gonna drop them in here, and I will drop in some before and after teeth bleaching ones as well, and show you how important it is. Yeah. So the secret is trust your dentist. Uchenna's not completely anti-these, but really you should get them from your dentist. Do you want to show them
Crest
how you
ones,
use it?
because the Crest ones are available from your dentist. So these, if you open them up, like I said, they look like little plasters. They're old, so they might not work anymore.
I should do one, shouldn't I?
And there they are. They're super thin. They are old, they've dried up. And then you put them on here like this. And fold them over.
See, what you can't see is, so for example, when you do this, it only goes halfway along. So you get a Tide mark. Like, you wouldn't have a Tide mark with your foundation, would you? So this is better, goes all the way down, which is why if you've done it, professionally first and then do this, it works, because it just maintains it. Oh, you're so good. You didn't even need to see anything.
I'm sure I made a complete balls up of it, Uchenna. I really have. I love the way you were doing this. You went, Nadine, I think that's your bottom one. But when these work, it's almost, because they're custom made for just me, it's almost like they're a suction. They go in. Yeah. Actually, they're quite hard to put back out again. Look, you get peroxide on your lips and stuff like that. You do have to be careful. My advice is, teeth bleaching, teeth whitening can change the way you look. It really can, but please go carefully. You really need to go via a professional.
Yes, or if you want to buy it, then just take it and ask your dentist if it suits you.
Oh, I love that. That's brilliant advice. So you can save that money.
Yes.
And the important thing is, if you've got any dental problems at all, if you've got any gum recession and you put hydrogen peroxide gel on it, it's like putting it into an open wound.
Yeah.
So you need to make sure your teeth are healthy before you bleach them, please. So ask the expert. Talking of ask the expert, I've somehow strong-armed Uchenna into answering all your questions. I will get her to come on YouTube and answer questions, but more importantly, if you just follow at Dr. Uchenna Okoye, and I'll put it on here, on Instagram, she's one of the rare people who will go on and answer every single question like I do. You can answer ask under a picture, and then everybody else will benefit from the advice. Or if you go into her DMs, she promises she will answer every one of your questions.
I will. I love it.
And in the meantime, next time you see me, actually, what I might do is I might take a before picture now,
and then
do my daytime bleaching, and then put my...
That's a good idea, and then we can see how long it takes to get the result.
Yeah, absolutely.
Oh, you're so good. Just put yourself out there to help us. I love you for it.
I make a fool of myself at all times, Uchenna. I don't have a problem with that. Thank you for watching. Thank you for subscribing. Make sure you follow Uchenna. She's absolutely brilliant. She will answer your questions. And if you've got any more questions for her, anything that's outstanding from the past 3 videos, let me know. She will answer every one of them. See you soon. Bye.